It was an awful feeling. I mean, every day I felt like I was out of my body.
Yeah.
Mentally, I was strained, and I was doing, 5 shots a day and
Right.
monitoring my glucose every 4 hours. It was a lot. So it was
Yeah.
kind of like being trapped in a body you didn't want to be.
Yeah.
You really sat me down and told me, look, this is what needs to be changed. I'm here to help you.
Are you on insulin right now?
Oh, no.
None
Not
whatsoever.
at all, and I don't have to test my glucose.
So-
I'm very happy.
Hi everyone, this is Dr. Chhaya Makhija, and I have an amazing guest today. As you've been watching our series with real patient stories and inspirations, I have Mindy with me today. And this is live in our office, and I'm very grateful for her to share her experiences regarding diabetes and everything else about the healthcare system in our body with you and inspire millions and millions of you out there. So let's welcome Mindy. Thank you, Mindy, for being with us. If you can just tell us briefly about yourself, introduce yourself to the world.
Well, my name is Mindy, and I'm 55, and I am your patient. I ended up finding you because I had diabetes ketoacidosis, and part of my discharge plan was to see a specialist in order to be able to get healthier. And so that's how my journey started with you.
Got it. So Mindy is talking about a complication, which is diabetic ketoacidosis,
Yes.
commonly seen in patients with type 1 diabetes. What type of diabetes were you diagnosed with?
I have type 2 diabetes, and I've been diabetic at least over 7 years. And ketoacidosis was the wake-up call that I needed to change how everything was done.
What changes did you have to make, like the initial few ones where you felt, or when we met? I know Mindy for almost a year.
Yes.
Slightly more than a year now. And what was it? Like, yes, you have to see a specialist, you have to see the endocrinologist, but what was going haywire with the care, with the treatment?
Before having ketoacidosis, my primary really didn't understand diabetes. So it was just being prescribed what supposedly was supposed to be prescribed for, certain blood sugars. The person didn't push me to take insulin because I'm afraid of needles, so I never went on insulin. And after a while, even with trying to diet, trying to change my health habits, my blood sugar just kept getting higher and higher, and it was not intervened.
So by the time you were hospitalized and then you were discharged, what was the regimen at that time before you sought care?
Right. So on my discharge date, the condition was I needed to find an endocrinologist, which the diabetic team actually helped me find you and said that I need to make an appointment. But when I left the hospital that day, I was on long lasting. I was doing 35 units twice a day. And then fast acting, it was anywhere from about 20 units. So I was probably on like 100 plus units of insulin in one day, and I was doing 5 shots a day and monitoring my glucose every 4 hours. It was a lot.
It was a lot, yes.
And I would say having needle phobia, it did not help because I had to rely on someone else to do that for me. Otherwise, I wouldn't want to do it either.
Yes, yes. In most of our other interviews, we've talked about diabetes burnout. We've talked about diabetes distress with our patients, especially our patients with type 1 diabetes, and how they've gone through their, these hurdles, these challenges. And you're saying 35 units twice a day, plus the mealtime insulin 3 times a day, plus checking your finger sticks, plus I don't like needles. I can't stand with needles, right?
And that's not including medication like metformin and everything else.
Right.
So, and it was an awful feeling. I mean, every day I felt like I was out of my body. Mentally, I was strained. Physically, I was perfectly not even half what I physically used to be able to do.
Right.
So it was kind of like being trapped in a body you didn't want to be.
Yeah. And I remember the first time we met, your team had mentioned that you will be on insulin lifelong.
Yeah, they said that from the looks of it, because I haven't been on insulin, that it will be quite a while before I'm able to reduce that insulin at all. They did not see a way of me doing anything different. So that was something they were trying to prepare me for. Yeah, so.
This is in June, July of last year, 2023?
I was in the hospital in September and I was in your office by October.
Okay, but the things that the first hospitalization, June, July, August.
I started feeling bad in June, but September was when I went in and was diagnosed with ketoacidosis.
Tell us, are you on insulin right now?
No,
none whatsoever.
Not at all, and I don't have to test my glucose either. So I'm very happy.
I know, I would be too. Yes, so that's where the physician and patient relationship establishes. That you want to understand the needle phobia. Okay, how can I help the patient rather than just prescribing another set of injections, right? Tell us your journey after that when we met. What were the first few things while being on 5 injections and 2 times of the long-acting insulin? Like the first 2-3 months, what was the change? What was like a milestone that you felt I was achieving, or any memories or anything that you can recollect?
I think the main thing was really, I would say it was a reality check. Because I mean, I walked into your office and you basically looked at my health history, where I'm coming from, and you were very diligent in, making sure you know where about my discharge and everything else. And you really sat me down and told me, look, this is what needs to be changed. I'm here to help you. And I think before it was just like, give me the medication, I'll take it, and that's it. I move on with my day. But with that, basically, I mean, I felt like I had to crawl into your office. That was how bad of a condition I knew I was in. So it was very important for me to realize that I want to be here 6 months and a year down the road, and I want to get better. And so, like I always say, it was the tough love that I was given, basically. You have to, I mean, as an adult, you don't want to hear someone tell you, you have to do this and you have to do that. And once I kind of realized, hey, once I started doing it, I felt better. I didn't feel like I was having an out-of-body experience every 4 hours. I could do more things and all that stuff. It's an eye-opener. So definitely it was a change. It was a change for the better.
And you had 3 children with you that you were taking care of.
Right, I had 4.
Yes.
They're older kids, but I'm kind of like the backbone of the house.
Yes.
Once I stop, they kind of stop and they focus on me, but but now it's kind of gets all better.
Did you use any specific techniques with the fear of diabetes, fear of phobia, especially with the needles, when you were on those 5 injections and finger sticks?
Right. Well, the finger sticks I can do on my own because I kind of refuse to let anyone else do it. But when it comes to insulin shots, I know you prescribed the smallest needle possible, and it just got to a point that I was not ready to inject myself in the stomach area, so it was always in the arm. And so I had one of my kids help me because she wants to be a striving nurse. But after a while, it just kind of got to a point where there was no more injection sites left, so the rotation was really important. But that was how I kind of, and then I tried to do it myself in my stomach once in a while. So it was kind of having to kind of put your fear aside because you needed this in order to get to the next level of a better health.
That's courage.
That's courage. It took a lot of it.
That's courage. And I remember because it was like back and forth discussions that we were having, and yes, I know. I remember I think both the kids, they used to accompany you.
Yes, they did.
During the visits. Yes, Tell us something about the needle sticks. So now you're not doing those. You're not barely requiring them once in a while.
No.
So what has replaced it?
So I've been using Dexcom since I started seeing you. And so that really helps me kind of stay within range. And then I'm on Ozempic once a week, and I don't even think I'm at the highest dose, but it works through the week. You know, I kind of definitely, there was a time when we first started and the Dexcom alarm was going off, like there was a fire all the time.
But how did the sensor make a difference
The sensor
versus the finger sticks?
Well, I think the finger stick was the last resort, just to make sure that, you know, both finger stick and you know, sensor was working together. But the Dexcom really kind of helps you kind of gauge where you are, or like when you eat, you know, okay, I can eat this and I'll be okay. Or I've had moments where I really want this, and then once I eat it, I regret it, and then the sensor shoots up, and then okay, maybe I won't eat that anymore.
So the first 6 months, or I would say first 6 and 7 months, there was pretty quick reduction in your insulin doses. Right? How did that make you feel, or did you ever envision that? How was your thought process around that time?
Well, when we first started, the doses were much higher, and then as I started to adjust my diet, know when to eat, what to eat, what not to eat, my blood sugar was going from too high to going low, and so then I kind of you know, then I come back to you and say, okay, well, now it's beeping in the wrong direction. And so you eventually just gradually lowered the insulin. And so, yeah, that was, I think, what made the difference.
Yeah.
You know, in terms of, because I knew what kind of food I could eat, when I needed to eat. So it was, you know, kind of a combination of me, you know, you, and, you know, whatever food is out there, and the monitoring and everything else.
You were very diligent in sending logs. You were very good with the notes in the apps, that, you know, what you were eating, how much insulin you were injecting, because that helped me to actually help you and reduce the doses pretty proactively.
And it definitely changed how my body reacts to things. Like my body will tell me when my sugar is going to go low, or my body will tell me, it's like, oh, you really overdid that sugar, you know. So I really feel more in tune with myself, versus before I just kind of felt numb. There was no feeling, because I ate, and then the sugar spikes, and what do I do? Like now I'm kind of more conscious about, you know, what I put into my body and how I can, you know, help reduce the sugar. You know, do I drink more water? And
how was the navigation through the healthcare system contributing to the diabetes care?
I'm trying to navigate with diabetes, trying to see a specialist. It's an uphill battle, and it just did not work for me. I remember being discharged, and when the diabetic team over there says, we found an endocrinologist here in Fresno, we think she might be the one that works for you, but you need to discuss with her about insurance. I just kind of felt that it didn't matter what it took, because it was either I was going to have to spend money somewhere else, or I'm going to spend it. For me, it was spending it on my life. And, you know, it's like, it's just, it's a very hard process, and you have, it's more than being diligent, because there are so many agencies out there. You talk to one person today, they forgot about you already the minute they hung up, and you have to keep repeating your story. And in the process of that, you've got to continue trying to get healthy, being a diabetic, and making sure you get the medication or the devices you need. It's something that you really can't do alone.
How do you envision your health now?
I definitely feel that I'm in a better place. I feel physically better. I'm more active, more mobile. Mentally, I feel that I'm in control again.
Is there anything else that you would like to tell individuals, adults, struggling with type 2 diabetes?
First, I would say my mistake was staying with a PCP who didn't understand the disease. Not understanding what type 2 diabetes does to someone, or not being able to provide information about nutrition and, you know, how your diet should be. That was my first mistake. And my second mistake was just accepting whatever medication I needed to take. which I believe contributed to
Mm-hmm.
having the ketoacidosis,
Mm-hmm.
and not having the support of knowing what the symptoms were of ketoacidosis. I mean,
Mhm.
it had started months before, and it started with simple things like hunger and being thirsty. It got to a point where my my skin felt like it was leather.
Right.
The day that I went to the hospital, I couldn't feel half of my right leg. I was
Mhm.
dragging along, and my PCP basically chalked it up to, you have circulation issues.
Mm.
And I sat in the ER for 8 hours before I got
Mhm.
admitted.
Mhm.
And the minute I got admitted, within 15 minutes, I had 3 IVs put in, and I was rushed up to the ICU.
Mhm.
So I was told, if you left, if you decided that you weren't patient enough, you left the ER, you would not wake up.
Mhm.
And I told him I wasn't going anywhere. I was going to go to sleep right here in the ER, and I'm glad I did. So,
Yeah.
it's definitely, as I reflect, I know, one is really having a doctor who knows what this disease is about.
Mhm.
And I don't think diabetes is a one type fit all. I think everyone is in an individual, how their health is. And also, I kind of realize now, is like, even with all the struggle with the healthcare system, you've got to invest in. Like for me, my
Mhm.
investment in seeing, endocrinologist is the investment of, prolonging my life.
Mhm.
Because honestly, if I did not find you or someone else who could help me at that moment when I came to the hospital, I might not have been around, through Christmas. So, but I'm here waiting
You're
for
here.
the next
Yes,
Christmas. So
you're here. You're rocking and rolling. Health
yeah.
is improved.
Yeah.
Remember, we just met 2 weeks ago.
Mhm.
And that was like at least like another milestone
Yes.
for this year.
Mhm.
Can you share something about that?
Well, I know getting off all the insulin and being on Ozempic, and once again, when you suggest any kind of another needle, I was like, okay, what are you giving me, and what are you taking away?
Yeah.
So I was hesitant, but I kind of realized Ozempic was probably the best thing that I can take at the moment. But not having to be on insulin, and being on, I think we took away a dose of metformin. So it's like being able, and for you to have such good record keeping, to be able to kind of point out where I was, where I've been, what you ate wrong, it's so detailed. It's like, I wish you didn't catch that sometimes, but just seeing where I was and where I am now, it makes me look forward to where I can be 6 months.
How do you envision your future now, 5 and 10 years?
5 and 10 years, I would love to see myself not have to take any more pills.
Mm-hmm.
And I definitely see myself getting healthier, so more active, and just kind of, being able to, I guess, live with diabetes, but also not having it control my life.
Mm-hmm.
That's the most important thing.
Yes, so you're the one controlling your health. Conquer it. Yes, conquer the good health. Yeah, thank you so much. Yeah, I really, really appreciate Mindy for being with us today. And go ahead and spread the inspiration. Thank you all.
Mm-hmm.